Hello, good morning. How's everybody doing? We can do better than that. Hi, my name is Paris Alston. I'm the host of GBH News Rooted at GBH, and thank you all so much for having me here. I am here with our lovely panelists, and I'm going to go down the line, starting with you, Nick, and ask each of you to introduce yourselves, what you do at your companies, and tell us one word that you would use to describe the landscape of employee benefits right now.
Oh, wow. Okay, there's one word to describe employee benefits landscape is AI dominated. I know I've snuck a few extra words in there, but it kind of works. I'm Nick, I'm the CEO and co-founder of Unmind. Unmind is a workplace mental health platform. We support global enterprises to really embed mental health as a core pillar of their strategy. Thinking about mental health as a performance topic, as an opportunity to get the most out of our people and therefore to succeed in our missions as organizations. I'm a clinical psychologist by background, and prior to founding Unmind, I was leading a health team in the UK's National Health Service. You might have picked up I'm English, and I just landed in Boston yesterday, which is a wonderful city, so delighted to be here.
I'm happy to have you.
And I'm John. I am with Sword Health. I am a clinical specialist and a physical therapist there. And what Sword Health does is it's a comprehensive digital musculoskeletal care platform that combines AI and clinical expertise to just expand access to care. And we also have advanced into the mental health space as well, using that same structure with a program called Mind. And I would say a word to describe, I would just say diverse. Now, there's multiple options out there, obviously. And yeah, a lot to choose from.
Hi, everyone. I'm Laura Wells. I am the VP of Total Rewards at Sun Life, and I oversee all comp and benefits programs in the US. I would say that the one word I would use is complex.
Mm-hmm. Hi, everyone. My name is Marina Vassilev. I'm the head of Total Rewards for Schneider Electric North America. We're an energy management and industrial automation company headquartered in France, and we have 42,000 employees in North America. The one word to describe the benefits landscape, challenging. I think on the company side, as benefits professionals, we have a lot of really big questions that we are facing every day.
Each of you so much. So Marina, I'm going to stay with you because obviously one of the number one components of employee benefits is the employees, right? So how important is employee feedback, and how do you use that to determine the benefits that you offer?
Yeah, that's a great question. And over the last few years, we have done a lot of work to evolve our employee listening strategy from what used to be a one-dimensional approach where we would have our employee engagement survey once a year and we get some high-level feedback on our total rewards, to actually having a multi-layered approach. And what I mean by that is now we're using different channels and different tools to get employee feedback and account for it as we build our strategy. We're partnering with an organization that is looking at how our employees valuing our benefits. They're building an index for us, and then we're comparing that value with how employees at our competitors are valuing benefits. So this has changed dramatically the way we look at our programs. In the past, we were solely focused on market benchmarking and how we compare to other companies. Now we're looking at how our employees are looking at benefits. We're doing a lot of pulse surveys. We partner with our employee resource groups to have focus groups and other sessions where they feed us with information that's valuable for our strategy. And I have even initiated something I call office hours once a quarter, where I have employees sign up and come talk to me one-on-one about benefits. It's a great way for me to kind of stay close to our employee population, get feedback on how my team is doing, how our strategy is evolving, and it has been really helpful in building trust with our employee population.
Mm-hmm. And Laura, I know this has been something that's been imperative for Sun Life as well, but what are the limitations for a company to truly be able to respond to employee feedback?
I think it's important to offer choice, which we work really hard at, but finding that sweet spot, right, in terms of not offering so much choice that employees are confused and don't understand what's available to them. So we do some of the same things that Marina mentioned. We have quarterly engagement surveys where we have benefits and compensation questions that are sort of filtered throughout those, and that allows us to have an insight on the sentiment of how employees are feeling. At Sun Life, we're uniquely positioned because we are a benefits company, right? So we get to talk about benefits all the time. So whether it's we have regular town halls and we're talking about our products and services that we offer our clients, and we get feedback from employees through that venue. We also have lots of communications in terms of regular communications like annual enrollment and other things. Just last week, though, I would say we tried something new, and it was actually very similar to this. So I was in your seat, Paris, and I facilitated. Yeah, I think I'd rather be in your seat actually, but I did facilitate a panel with 4 employees, and really what the focus was having employees talk about how they made their decisions about their benefits, how they choose a health plan, how they decide how much money they're going to be putting, whether it's in their retirement plan or within a health savings account, and having other employees hear directly from their peers was really a great way to kind of simplify, sort of demystify, have things feel a little bit more manageable. And that was really one of our first steps to really kind of take things down and make sure that folks understood that it's not as complicated as it may seem. So we do focus quite a bit on making sure that we are reaching employees in various ways.
Mm-hmm. Now, Nick, I imagine that the demands for what employees want are changing a lot now because of the increase we're seeing in mental health issues, whether it's anxiety or burnout, or any other condition that could come about for someone. So how does a company respond to those challenges, especially when you're trying to be as productive as possible in a changing landscape?
Oh, it's a great question. I mean, you touch on the prevalence of mental illness, and I think it's easy in a world where there's constant transformation and constant new global events taking up the news to forget that we're in a mental health crisis still. And our people, I've heard on stage today already talk about transformation. I imagine each organization here is going through some sort of transformation. Transformation is really hard for human beings to have as a constant, perpetual state, and it puts huge pressure on people. And yet, those very people who we're putting pressure on through transformation are the same people who we rely on to make the transformation successful. So what's absolutely critical is that we do everything to support them. And that includes looking after the people who are in crisis, the 1%, but it also includes looking after the 24% of your workforce who are going to have mild, moderate mental health needs. But most importantly, it involves getting upstream. So within any population of any workforce in this room, 75% of the workforce, we should be focusing on promoting well-being. And that can come in many different terms. We can talk about resilience, we can talk about mindfulness, we can talk about neuroscience, all this kind of language that gets put on that aspirational side. But it's so important we get upstream to make sure our people are well.
How do you convince an organization that is going to be a boost to their bottom line?
Well, the evidence is very clear. There's been some fantastic studies from the likes of Harvard and Oxford universities recently, clearly proving the correlation and causation of well-being and productivity of an organization. So the evidence is very clear in the literature, but also organizations can do research themselves. We actually have a research team in-house. We partner with leading universities and then with global organizations to do research in their own organization to prove the efficacy of their programs so that they can not only see the ROI, but they can also clearly see the impact it's having on their mission as an organization.
Mm-hmm. Thank you. So, John, you work for one of the vendors, like Laura was talking about, that would be integrated into these point solutions. As a physical therapist, specializing in musculoskeletal care, I imagine there are a lot of people sitting at desks for a very long time who could use your services, myself included. But what are you seeing in terms of demand for these kinds of services now? And especially we know mental health is not just here. It's total body holistic health. So how does that connect to what Nick is sharing?
Yeah, so obviously there's a connection between physical health and mental health, and that's why we at SWORD, I'm just going to talk a little bit about SWORD first, but that's why we started out with our core programs that were focused on physical health. And when doing that, we then found that we were seeing improvements in things like anxiety, depression, work productivity, quality of life. And so some of our members that we were working with, we found that they needed additional care that we weren't able to touch. And that's why we then expanded into that mental health space to kind of bridge that gap, because we know there is that connection, and it's vital that we address all of those.
Mm-hmm. Is that, I think, I know a lot of companies, and my GBH included, will do things where they have like massage therapists come for the day, or maybe there's yoga being offered. Do you all do things like that?
Well, since we're a digital care company, none of the massage therapy part is involved.
Unfortunately.
Yeah, unfortunately. But we do things like webinars on ergonomics, webinars about just pain in general, so to educate people, that we do provide to our clients so that we can like reach their employees and provide that education.
Excellent.
Yeah.
Now, of course, the elephant in the room here is that none of these offerings are cheap. It takes a lot of resources to be able to provide benefits, and we know that healthcare costs are rising. So Marina, how do you balance the cost efficiency with delivering to employees what they want and what they need?
It's a great question. I would say, again, it's multi-layered approach. We partner very closely with our vendors. And as we decide to introduce a new partner, we look closely at what is the ROI that they can bring to us, and whether they're a good fit for our ecosystem and how we can integrate with them. So this is key. It's also key to continue to look at the vendor partners and at some point also make a decision to change the partnership or transition to a different vendor if it's not working out as expected. So this is one way to manage cost. But the other way is on the employee side. And what we have done at Schneider is introduce a program 3 years ago called Benefits Bucks. So benefits dollars, and it works almost like a cafeteria plan. So instead of creating a life savings account or life planning account, we have that allocation that we give to every employee, and they can allocate it to different benefits, including buying into a sabbatical program, purchasing paid time off, contributing to the medical plan. So this is very helpful both for our employees and for the organization, because we're recognizing the personalization that's needed for employee benefits. Everyone has different preferences and different needs, and when we give them that opportunity to make the selections that work best for them, we're being most useful for them, and we're being really very mindful of our resources. So it has been well accepted by employees, and it has given us an opportunity to partner with them and make sure that they are making the right selections during our annual enrollment process.
Now, of course, healthcare in the US is quite unique from the rest of the world. I know Schneider is a global company, and so I'm curious about what challenges you face unique to your employees in the US.
Yes, I would say in the US, the rising costs of healthcare have impacted us, and I'm sure many other organizations. What we saw during the pandemic was delay of elective procedures, delay of care. So we had a very different medical trend than what we are facing today. So we have to be even more vigilant and mindful with our resources. And what we have done again with Benefits Bucks, the program I mentioned, is increase even more the opportunities for employees to allocate those funds. In the beginning, when we started the program, we decided not to allow allocation to the medical and dental plan because we felt that those plans are already heavily subsidized by the company. Now, with the rising cost of healthcare, and since we have a certain cost share matrix that we need to achieve, we have decided to allow employees also to contribute benefits bucks to medical and dental, and in this way, we are supporting them.
Mm-hmm. So, Nick, the word you mentioned at the beginning was AI dominant, which, of course, we've talked about this prior to coming on stage about how AI is everywhere and will continue to be everywhere. Can it be a partner in alleviating costs? And if so, where do we anticipate challenges and how do we mitigate those?
I mean, we've got 3 hours, right, for this question. I think it's a great question. Look, if we take a step back and we think about where are we today? So we have, as we've referenced, the mental health crisis. There's an estimated 1.6 billion people in the world seeking care for mental health. 1.6 billion people. 1.2 million practitioners are able to treat them. So there's a massive supply-demand issue, right? And then you're just talking about health inflation. Health inflation is an issue around the world, and it's crippling our budgets and our ability to deliver care. And then also, what I mentioned earlier is that we want to get upstream, so we want to do prevention. So there's not enough resource to do reactive care. We can't afford it, and we can't get upstream with our current resource. So it's not a case of, maybe we should play with AI in healthcare. It's a case of we urgently need to integrate AI into healthcare. But in the same way that you wouldn't go and see a doctor or a dentist if they didn't have the right qualifications, you also shouldn't go and engage in any AI tool that isn't appropriately built for the purpose, right, of healthcare. It's absolutely critical that these tools are designed and built with clinical rigor, with transparency and accountability, with privacy at their heart. And then when they are built in a really good way, and if you want to read more about that, the World Health Organization has published great guidelines on how to integrate AI into healthcare. If it's built in that way, then suddenly AI becomes not a threat to the healthcare system, but it becomes actually the latest member of the multidisciplinary team that sits alongside the psychiatrists, the psychologists, the social workers, etc., in a way that enhances our ability to deliver timely, preventative, high-quality, scalable care. So I think it's not a should we, shouldn't we? It's not will we, won't we? It's we need it, and it's happening now. And we've done some fantastic work at our Mind in AI. I'm really excited about the way it's transforming the way people are engaging in hyper-personalized preventative healthcare. So I'm very excited about it. Yeah.
If only we did have 3 hours. Next panel.
Can I chime in on that too?
Of course.
So, yeah, I think it's about finding the balance between incorporating it into, like for me, the healthcare field, but without replacing the clinicians. And that's at SWORD, we're finding that balance. Like I said, when I described what SWORD is AI combined with clinical experience. So I'm a physical therapist. I still have full control over everything. But what we're doing is, for example, one of our programs is called Thrive. We send a tablet to the member's home. They get to do physical therapy on their own time, in their own home. And the tablet itself provides that real-time biofeedback to them so they know if they're doing it correctly. And then it's sending me all the data as if I was there in person with them so I know exactly what they're doing. So it's not taking me out of it. It's just giving me more information to then be able to help these people, but also to make it way more convenient for them to do at home.
John, I think you're absolutely right. I don't know any good healthcare professional who says, the thing I've got loads of is time, right? Every healthcare professional that's good is managing waiting lists, is struggling to get the admin done behind the scenes, is struggling to meet all of the people who want to see them. What AI can do is help the best healthcare providers deliver better healthcare by lifting off some of that need. I totally agree.
And Laura, when Nick and John are both sort of talking about this multidisciplinary approach, I mean, you talked about point solutions, but we all know there's point solution fatigue, where sometimes there's too many choices.
Yes.
And so could AI be a partner in helping streamline some of those offerings?
I think so. I mean, I think from an ROI perspective, it's definitely an opportunity. You mentioned a bit about, looking across the portfolio, optimizing programs. So there was a point when I first stepped into my role where I was like, we are never adding another point solution. Since that time, we've added a few, but I think it's about looking across the portfolio and making some decisions in terms of programs that we've implemented in the past that maybe are no longer as useful or not really addressing needs of our current demographic and making those decisions so that we can bring in something that is more current, more relevant to our employees. So the other aspect of AI, which I think could be very helpful, is helping employees navigate that landscape, right? So how do employees find out about these different point solutions that we offer? So if an employee has an issue with musculoskeletal issue or whatever it might be, how do they navigate within our portfolio to find the solution that will help them? And I think that AI can definitely provide support from that perspective.
And Marina, what about on just the everyday employee experience side? Like, are there ways where AI can begin to take some of their task off as a means of increasing their well-being at work?
Yes, I think it's really an exciting time for benefits because AI could be very helpful for us on the company side as well. What is challenging, I would say, at Schneider and probably at other organizations is finding the internal resources to work on developing AI solutions that can support our employees in making the right benefits decisions. So we're looking very much to the vendor landscape, and we're excited to hear about the investments you're making and the enhancements that you're bringing to us, because that can be leveraged across multiple employers and definitely saves time for employees, makes the experience much better, and it's very helpful for us as it helps educate and answer questions that employees are raising, which is important for the overall experience.
Nick, I'm curious if you or John would have any potential solutions for Marina.
Well, I just think that one of the things that you mentioned earlier on, which was really interesting about employee listening, one of the fascinating things about generative AI, of course, is that people are engaging and talking to it. So it's constantly gathering information which you can aggregate and anonymize to bring insight into all sorts of things that historically were quite invisible to organizations. It always fascinates me. We work with hundreds of big, well-known global organizations, and I think very few of them would put their hand up and say, we're really proud of the way we measure employee mental health. And yet mental illness is the leading cause of absenteeism, presenteeism, and staff turnover, and it's often the thing that's not being measured in employee surveys. And I think generative AI within the ecosystem of mental health solutions can help to bring to the fore aggregated, anonymized, critically anonymized information to help understand how our populations feel around the world, wherever they are. Because, of course, the other great thing about generative AI is it can speak every language, which can be incredibly helpful to bring parity to global populations like yours. But I also don't think that it's helpful for generative AI in mental health care to be a single point solution. I think it needs to sit within an integrated platform. I think employees find it hard enough to navigate the solutions that are available, as you've commented on. So the way we built Nova, which is our AI agent, is it can seamlessly signpost to 700 hours of content, or to all the EAP phone numbers, or to practitioners and coaches that they can access wherever they are in the world, because it's built within that system. That's what I'd say.
And how can AI, I'm curious, Nick or John, what you think about this, like how can it, or any of you really, how can it alleviate the cost burden that is associated with offering benefits?
Well, I mean, I think it's going to be huge, is the short answer. But just to be, the most important thing with healthcare is that we get the right care at the right time. The timely care is critical. We know it in our in dental health, we know it in physical health, and we know it in mental health. So what I don't believe is going to be appropriate is to say, well, when someone's in crisis, we give them AI. It's about knowing what the right care at the right time is. So that person is still going to require a more expensive intervention led by highly qualified practitioners, often in hospital units with medication, etc. But historically, the way that we've tried to scale up healthcare in preventative forms has been largely very unpersonalized. And what that means is it's not very engaging, which means it's not very effective. So what AI can do is actually, it can meet a large group of people in a highly personalized way, in a very affordable way, because the core cost is not the same as a highly qualified practitioner. So I think it can help absolutely on that point.
And so, John, does SWORD offer any personalization tools